hope you are all doing well. My name is Rita Matos, and I am one of the authors of this paper titled Medical and Healthcare Information Systems in Portugal, short literature review. Let's start by a brief introduction. As the world embraces technology, it becomes apparent that there is a progressive need to use information systems in all fields, especially in the medical one. While doctors and human resources will always be needed, health information systems (HIS) could manage healthcare costs, improve the care, as well as decision support. As we've seen, medicine and healthcare have changed a lot in the last years, with major improvements in the last 20. Companies have gotten into the development of software and hardware for healthcare, especially the emerging field of medical information systems. Going into on how we organize our work, we focused on questions such as how medical and healthcare information systems have evolved, what are the main focus of health information systems, what are the current issues on the implementation of health information systems, and finally, what are the prospects of health information systems, meaning what can happen in their future. To answer such questions, we focus our research in terms such as information, systems, healthcare, and evolution. With those terms, we investigated PubMed, Scopus, Google Scholar, and various journals in our quest to find the most relevant information for our work. Having the goals of our work defined, we gathered the brief evolution of health information systems. Beginning in the 1950s, the first signs of HIS appeared when talks about using computers to automate some of the medical personnel work. But it still took 5 more years for one of the first softwares of medical information systems to be developed in California. Then, in 1967, the International Medical Informatics Association was created, and the first meeting happened in the following year. During this decade, HIS was used primarily for managing inventory and billings, all in a single database. During the 70s, departments relating to medical informatics popped up around the world. One of the first being the one in Amsterdam, followed by the former Soviet Union. Besides that, professors from several countries published papers discussing the term medical informatics. Getting to the 1980s, the first ever degree of this field was created in the Stanford University. It was also in the 1980s that European funding started to appear for research in this area. During that decade, most paper records started to get digitalized and computer records were created. This was a big step to make medical informatics known worldwide. Reaching the 90s, this field has consolidated its position as a separate discipline where most medical-related degrees included classes on this matter. Telemedicine research starts, medical imaging keeps developing, and electronic health records keep improving to include data protection and confidentiality, turning into the norm to use electronic health records. When getting closer to the present, new study areas related to information systems appeared as bioinformatics, hospital management, among others. Looking back at the past, it can be clearly seen a big improvement over the years, with huge steps being taken to improve this area, with more and more research appearing. However, we must not forget that the level of medical information systems depends on the country as well as the socioeconomic context, as we see far more progress in the first world countries. Nowadays, HIS has three main focuses. The first one is managing, storing, and transmitting health data, which is one of the most developed areas of information systems in the medical field. Data is constantly being produced in healthcare, ranging from prescriptions, exams, and even billing. Data collection allows healthcare workers to have an easier access and management of patient data by storing it electronically, which would create a faster and more convenient way of gathering patient data records without wasting time in manually looking for them. Electronic records would also assist in providing correct data between several medical organizations, improving the patient's chances for a better treatment. Nonetheless, there are still issues regarding the electronic storage of data, most of which involve laws and patient safety. Patients' rights and confidentiality are a reason of concern when medical records are kept electronically and shared in different healthcare organizations, since not all people agree in sharing all their information with different associations. Some examples of Portuguese health information systems that manage, store, and transmit data are S-Clínico, which was created by SNS, National Health Service, and allows medical personnel to register patient data electronically in shared databases. Another one is PDS, a healthcare data platform, which allows medical workers from National Health Service to have access to their patients' information database. The second focal point is helping with decision support, as it would allow a wide range of improvements, such as patient safety and cost control. A benefit of incorporating decision support systems would be the offer of a quick diagnosis with the use of patient records. Even though HIS brings amazing benefits to the medical field, the systems still have their pitfalls. For example, the workflow of the healthcare staff would need to be adapted to the system, resulting in wasting time training the medical team. An example of HIS help in decision support is the online screening of the National Health Service. The software allows patients to evaluate their symptoms and receive information and advice regarding their health. Still, the results of the online checkup aren't 100% trustworthy, as the evaluation must not replace one done by the professional worker. Finally, the development of the Internet. With the development of the Internet, more and more forms of communication between doctors and patients have appeared, as a form of assisting in long distance patient care. With the use of the Internet and its resources, the healthcare system can create a connection network that links several medical workers to easily discuss patient care options and schedule appointments. Despite HIS' great evolution, over the years it hasn't efficiently been incorporated into healthcare systems yet. Some of the current difficulties of healthcare information systems are lack of support from the hospitals, since they don't want to waste time and money by exchanging their usual systems and work ethics. Information confidentiality due to the fact that medical information is highly sensitive, requiring an enormous level of security and confidentiality. With HIS, data has a higher risk of security breaches, medical data leaking, or patients' data being exploited. There is also rejection from the medical staff that feel that healthcare systems may take away their jobs, especially systems with a focus on decision support. When combining the lack of integration of HIS with the professionals' fear of losing their jobs, healthcare systems gain a poor reputation that delays their implementation. Associated with the previous point, patients have trust issues regarding HIS, influenced by the opinion of the medical staff. The opinion of the professionals, then combined with the risk of their medical information leaking, makes the public apprehensive to share sensitive personal information. And while the extensive information gathered with different platforms appears to be beneficial, with the lack of connection between databases, affects the availability to access records at any place and any time. Lastly, while the implementation of HIS can be extremely beneficial, it is expensive to invest, which delays its incorporation. Health information technologies are still poorly suited tools due to a multifaceted environment, in which it is difficult to satisfy all the needs inherent to the patient, professionals, and organizations. There is a need for technological change that can take all these factors into account and achieve interoperability between different systems. Some examples of future opportunities and challenges in healthcare information systems are the study, development, and application of systems that allow health information exchange (HIE) between all hospitals to electronic medical records. HIMSS is a non-profit organization that helps companies work towards an electronic healthcare environment consisting of the electronic medical records adoption model that incorporates methodology and algorithms to automatically score hospitals worldwide regarding their electronic medical records capabilities. This model has 8 levels, 0 to 7. The HIMSS level 7 allows for continuous electronic information exchange, enabling a fully functional electronic record that shares patient data with local health units and clinical decision support systems that are used 90% of the time. HIMSS level 7 has already been reached by a Portuguese hospital, Hospital Cascais, Dr. José Almeida, sharing the vanguard of a restricted elite of 3 hospitals in Europe and 6% in the USA, with its expansion being a future perspective. The evolution of data sharing between providers and the patient himself through a cloud, which alerts hospitals to an evolution in terms of management, security, storage, analysis, and interpretation of the data obtained. Data aggregation, enabling interoperability in order to overcome organizational boundaries. Cybersecurity is also an important factor since computer attacks against hospital systems containing personal data are increasingly recurrent, which causes some fear in end users to provide their data and personal information to third parties. The growing development of smart devices capable of responding to electronic signals and connecting with healthcare facilities such as patient-specific data or real-time monitoring of their vital signals, which will have numerous advantages from the point of view of hospital resources, reducing diagnostic tests and other procedures. The use of robots that are integrated into HIE system to dispense medication or perform hospital disinfection. Considering the patient as a user, that is, the patient has access to his data, being able to edit or even delete them, having greater control over his records. This innovation can bring some associated risks to the hospitals, since the patient can function as a communication facilitator by being an active participant or as an interfering participant that is, not communicating the necessary data, making the relationship between health professional and the user. Concluding, the globalization of the computer technology business associated with health is one of the main trends. Currently, anyone is a potential consumer of data, and the possibilities of the IT market are still limitless. The main producers of these technologies include the USA, Japan, France, Great Britain, Germany, and Singapore, among others. The implementation of HIS is not a constant work. There are several factors that change over time to which HIS must adapt. There is a need for a long-term perspective. That is, HIS must be seen as a journey that must be fulfilled in order to reach the goal, a future in which the wealth of data allows safe, efficient, and high-quality care. The increasing use of HIS is inevitable, and its variety will proliferate in the coming years as we migrate to ubiquitous computing environments. However, there are ethical and even receptive aspects on the part of health professionals that cannot be forgotten because they are the sources of gaps for this type of systems. The future is promising for HIS that can support the provision of integrated patient-centered healthcare. Hope you liked it. Thank you.